Hi, Dr. Dave Hindmarsh. In this short video, what we're going to do is talk about the research that we've been done about increasing our NHS diabetes prevention pathway referrals through the use of YouTube. Really fascinating work, so stick around. So what we found is that our practice is full of patients who are highly intelligent, highly motivated, and really want prevention rather than cure. So when we got the statistics through that our NHS NDPP referrals were only 2 in the past 6 months, it didn't make sense. And we're thinking, hang on a second, what can we do to engage with our patients to try and improve these referral numbers? Now, we'd set up a YouTube channel 4 years ago within the practice, and we posted the odd video really to update them, say about flu vaccine, trying to get a new GP on board, or perhaps if there was something in the media that we really needed to try and tackle on early. And we thought, hang on a second, couldn't we use this to then try and target our patients who are eligible for this service, who for whatever reason haven't uptaken it? And we'll just outline this. So what we did was we shot a very short video, and I'll leave a QR code as it sort of hopefully should fly up so that you can go and watch it yourself. We then used AccuRx to then target these patients with basically a short paragraph saying, hi, you've got prediabetes, you may be eligible for this service, please watch this short video and let us know. The video then sort of outlined again a bit of the information about prediabetes and also the NDPP and what it could offer for them. We then gave them the option within AccuRx to either one of 3 things. One, like decline, don't want to do it, thank you very much. And the benefit is that we could automatically read code that back into the patient's notes. The second one saying, yes, please, I want to be referred, please do it, which we could quickly and easily do. And then finally, I want an appointment. So at the time of submitting this abstract, we'd sent it to 40 patients, and we got 15 patients who wanted to be referred directly with no extra appointments and no further contact from the practice. Fantastic news. And out of those, we had 1 patient who wanted an appointment to discuss it further. Now, I spoke to the clinician who had that appointment, and it was a lot easier. It was much because the patient was more informed about this, and they just wanted a couple of questions answering prior to agreeing to it. Now, this raises the question for future research, and we've done a lot more work on this already. So we've continued to target our pre-diabetic population, and we have boosted those referral numbers up using this method. And we're also gathering feedback as we sent a short questionnaire afterwards, just to basically say, what do you make of this service? This was generally done with a Likert scale, and we asked them set questions about, the video itself, whether they found it engaging, whether they trusted it, etc., etc. And the results from that were quite interesting because they recognized the doctor within the video, they found it more trustworthy, and also they found it a really useful way of being engaged in terms of highlighting NHS services. This really highlights future developments. So we've already done similar work in improving our diabetes remission program through a similar technique. And we think, what's next? So the obvious answers of where can we target patients who may not be well educated on, or we have a different take on than, say, media wider has been promoting to them. Things that spring to mind, statins is the obvious one, HRT medication, and also GLP-1s. Are people safe taking these? Do they have all the facts to hand? The next point as well, think about where the NHS is pushing. Could we use this more for lifestyle medicine, preventative medicine, and also with the wider neighbourhood teams coming to the fore, could we use this to actually advertise of what they are, how do you access them, who is at your fingertips to help, not just thinking your classic doctors, nurses, etc. So if you're interested in this, please feel free to drop me a line, david.hindmarsh2@nhs.net. We've done a full publication which takes a wider data set, and I'd love to share it with you. Also, if you're interested or just want to chat about setting up your own YouTube channel for your practice, please drop me a line. Again, david.hindmarsh2@nhs.net. Look forward to seeing you at the conference. Please feel free to come along and say hi.